This is you on...
That's me on Dash.
Shawn Todd lived every country girl's dream, growing up riding horses outside Mobile, Alabama.
So barrel racing and horses are your passion?
It is, very much so.
Are you barrel racing now, Shawn?
No, I'm not.
Shawn says she was forced to put her passion on hold after her bladder and ureters were burned in what was supposed to be a routine robot-assisted partial hysterectomy in 2011.
Did you ask him any questions about the robotic surgery? Did you ask him if it could be done laparoscopically some other way?
No, sir. He said that this was the way to go. I trusted him.
For 5 days after her Da Vinci surgery, Shawn says she had trouble urinating, and finally she was rushed to the emergency room.
They scanned my bladder, and the tech said, "I've never seen this before." She said there's no urine at all in her bladder. None.
Shawn says with her organs starting to shut down, doctors went in and found those unexpected burns. She says they told her the only way to save her life was to insert catheters directly into her kidneys. That's when Shawn says her real nightmare began.
He said, "Miss Todd, I'm sorry." He said, "but this is going to save your life." And it was torture. But they held me down, and they stuck me 4 times with needles that went down into my back, into my kidneys. I was just praying, am I going to make this? Am I going to have a heart attack from this pain? They got everything in. He said, "Okay, you're going to live. You're going to live." They were clapping. They were loving on me and hugging me. He said, "You're going to live. You're going to live."
Dr. Francois Blaudeau is a gynecological surgeon and Shawn Todd's attorney.
Good to see you. Good to see you.
He thinks he knows exactly where the Da Vinci robot-assisted surgery went wrong.
Intuitive Surgical provided a robot for benign hysterectomy surgery. And as a consequence of providing a device that had product defects in it, patients had been injured.
You know what some people are probably thinking? Watching this, and they're saying, this is nothing but an ambulance chasing attorney looking to make a buck.
I'm a surgeon. I'm an attorney. I care about patients. I care about patient care. I'm a surgical educator. I didn't go down this road as an ambulance chaser.
The problem, Blaudeau claims, is the injury can also occur outside the surgeon's operative field of vision.
There's a portion of the arm of the robot that extends into the lower pelvis where the surgeon's actually operating. And the surgeon puts a camera in, and that camera comes in and is positioned above the area where the surgeon is working and shows that surgeon that visual field. So there's a portion of this arm that's actually behind the camera that the surgeon does not see. As the surgeon uses electrical energy at the tip of his instrument, if there's a loss of insulation protection in the upper part of the arm, then you can get sparking of electrical monopolar energy from that can injure adjacent structures, so bowel, bladder, the blood vessel.
Blaudeau provided CNBC this video he says shows how a stray current can leave the Da Vinci surgical arms, causing collateral damage. And this video, recorded in mid-2012, provided by gynecologist Dr. Eunice Bakri, also shows stray current leaving the monopolar instrument. Intuitive Surgical, for its part, says monopolar energy instruments are not unique to robotic surgery and says it is confident that the Da Vinci surgical system deploys monopolar energy in a safe and effective way when used as indicated. CNBC obtained internal company documents that show in May of 2012, Intuitive Surgical introduced a replacement to its tip cover accessory for Da Vinci's monopolar instrument. The product notification letter requests hospitals begin using the new version immediately, acknowledge receipt of the letter, and return older versions for credit. Intuitive also states this is not a product recall, adding, nevertheless, the improved resistance to damage by the newer model is an important advantage. The company told CNBC it invented a new bonding process that allowed production of a more robust tip cover, and adds, the original tip cover was not deemed defective. However, the company replaced existing customer stock with the new tip covers when they became available. Intuitive also states the new tip covers were cleared by the FDA in 2011. Tip covers are replaced after every procedure. But Dr. Bakri also provided CNBC this recording of a surgery 7 months after the company's product replacement. It also shows a stray current coming off a new tip, which he says indicates the problem still exists. In an email response, the company says, based on extensive review of the video, we are certain that what is being observed is not an instrument or tip cover failure. The electrocautery energy is coming from the scissor blade as designed. The company adds, the arcing seen in this video would occur in a laparoscopic instrument the same way if operated in this manner. Dr. Bakri told us that while he remains a proponent of Da Vinci for select surgeries, he still has concerns. We also found other reports in the FDA's database as recently as February of this year where the monopolar curved scissors burned a patient's organ. The injuries, Blaudeau claims, are sometimes not apparent for days, even weeks after the initial procedure.
So the patient goes home, they look okay. They might have some abdominal pain, maybe a little bit more than somebody normally would have. Then they go home, and then typically what happens is they get swelling of their belly, they don't really want to eat, they start to get a little temperature, and then that progressively worsens.
For Gilmore McCall's daughter, Kimberly, 11 days after a hysterectomy at Montefiore Hospital in New York, her health took a turn for the worse.
When we rushed there, I couldn't describe the scene that I see.
According to operative reports, Kimberly suffered bleeding from a main artery into the pelvis.
Blood was flowing from our leg, from between our legs, and two nurses was there catching the blood with buckle.
Kimberly died at 24 years old.
I said, Kim, I know I'm not gonna hear from you again, I'm not gonna see you, but one thing I can promise you, that I'll see you in heaven.
McCalla is suing Intuitive Surgical, claiming his daughter died as a result of injuries sustained by the Da Vinci. The California-based company denies claims of injury by the Da Vinci and has refused requests for an interview. In an email response, Intuitive says it will not comment on active litigation, including Sean Todd and Gilmore McCall's claims. Coming up,
There have been estimates out there that maybe only 8% of the cases ever get reported.
who's keeping track, and are the numbers accurate?